would be used.
Sounds great. Thank you.
Thank my colleague. Next is Senator Warnock, and then the very patient Senator Welsh, who's been here for everything. Senator Warnock.
Thank you very much, Ranking Member Wyden. Last week, House Republicans took the first steps to renew tax cuts for the ultra wealthy. And based on their own budget, these tax cuts are going to cost Americans $4.5 trillion. According to the Treasury Department, the entire bottom half of working families, that's folks making less than $75,000 a year, will see less than 8% of the benefits. But they're going to be stuck with almost 100% of the burden to pay for these cuts, since Republicans in Congress are planning to gut programs like Medicaid, food assistance, Pell Grants to afford their massive giveaway to the rich. Dr. Faulkender, I'm looking for a number. If Republicans slash up to $800 billion from Medicaid, as our own budget suggests, how many of the 70 million Americans on Medicaid will lose their health care coverage?
Thank you, Senator. Medicaid is not a program that's overseen by Treasury, and so I have not looked at the impacts. Not only that, I'm not familiar with any cuts to Medicaid.
Do you agree that we might want to know how many Americans would lose Medicaid with $800 billion slashed from Medicaid?
Okay. Again, Senator, I'm not familiar with cuts to Medicaid. What I am familiar with is that the Tax Cuts and Jobs Act actually increased the progressivity of the tax code. It increased the percentage of tax receipts paid by the top 1%.
So do you think that it's a good idea to take families off of Medicaid? And how many families are you comfortable with cutting off of Medicaid in order to get this tax cut for the richest of the rich? I'm asking you this because you're an advisor to the president.
Senator, I definitely think that having people find self-sufficiency and getting into jobs that allow them to have their employer provide health insurance to them is a much better outcome than having government provide it.
So you think Medicaid is a bad idea?
I think people realizing self-sufficiency and getting off of government dependency is a good thing.
Does that include the children who benefit?
I think children benefit when their parents are employed, yes.
Okay, so let me talk about something that you and I do agree on, and that is that our debt is too high.
Mm-hmm.
And even after taking away health care and education programs from families, which I think is a bad idea, and I'm not heartened by the fact that your answer to the millions of Americans who need Medicaid is that they ought to find some other path, regardless of their circumstances. I'm not heartened by that at all as an advisor to the president. But you and I do agree that our debt is too high, which adds to the burdens and the costs of ordinary Americans trying to afford a house, trying to afford a car, trying to make their lives work. Still, Republicans don't have a plan to pay for their partisan budget bill. I think that's a bad idea. So I'm worried that we're going to add to the federal debt. And thanks to these higher interest rates that we've already discussed in this hearing, that will result in runaway national debt. Our children today won't be able to afford a car or a mortgage years from now. As an alternative approach, in 2013, Congress, on a bipartisan basis, extended the Bush tax cuts for anyone except those making more than $400,000 a year. This decision made by Republicans and Democrats working together and finding compromise saved the Treasury $600 billion, helping to narrow the deficit. If confirmed, would you support a bipartisan compromise that cuts taxes for working families but not billionaires?
Senator, I would support making sure that America's small businesses don't see a tax increase, which is what would happen if we allow the Tax Cuts and Jobs Act to expire.
Would you support a bipartisan compromise that cuts taxes for working families but not billionaires?
Senator, I would support full extension of the Tax Cuts and Jobs Act to ensure that America's families don't face a $1,700 tax increase.
Even though you like me, you're concerned about the debt, you would extend this tax cut to billionaires.
Senator, as the Secretary said when he went through his confirmation hearing, we have a spending problem, not a revenue problem. Revenues are coming in line with historical numbers. It's spending that has greatly exceeded the historical average.
I think that the folks who are losing their Medicaid right now, who are without health care, and who, as a result of that, might not be able to work, would disagree. Thank you so much.
Thank you, Senator.
Senator Welch.
Thank you.